Did you know that by the time you finish watching this video, about 20 seniors will be diagnosed with dementia? That is one person every 66 seconds. But here is the terrifying part. What if the cause is not aging, but what is sitting in your medicine cabinet? You have been told these pills are safe, routine, and even essential. Yet new research is sounding the alarm. Almost all seniors, 99%, have no idea that at least one medication they take could shrink key memory centers in the brain by more than 28% in less than a year. Let that sink in. The pharmaceutical industry has known this for decades, yet it continues to profit billions by selling the very drugs that may be speeding up cognitive decline in millions of seniors. In fact, a study published in 2023 in the journal Neurology and Aging Research found that one class of drugs increased dementia risk by 49% in seniors within just 2 years of use. In this video, we will reveal the 9 most dangerous medications that trigger rapid memory loss and dementia, ranked from commonly ignored to brain destroying. And the third one on the list. It is prescribed to millions for something minor. Yet it can shrink memory centers in your brain, and you probably do not even realize it is happening. Before we dive in, let me know in the comments. What medications are you taking daily? Have you ever experienced sudden brain fog or forgetfulness? We read every comment and reply with personalized insights. Do not stay silent. This could save your mind. Now, let's start with number 9. Do not be fooled by its position on the list. This one is in almost every senior's cabinet, and it could be scrambling your brain before you even notice. Number 9. Diphenhydramine, also known as Benadryl. This is the familiar pink pill millions trust for sleep, allergies, or cold relief. It is cheap, over-the-counter, and likely in your nightstand right now. But while you think you are just getting rest or easing symptoms, Benadryl may be interfering with the hippocampus, the region of the brain responsible for storing new memories. Benadryl belongs to a group of drugs called anticholinergics, which block a neurotransmitter known as acetylcholine. This chemical helps your brain form new memories and stay alert. As the brain ages, it depends even more on every bit of acetylcholine it has. When this drug disrupts that process, the results can be devastating. According to a 2023 study in the Journal of Geriatric Cognitive Health, seniors who regularly used anticholinergic medications had a 54% higher risk of developing dementia compared to those who did not. So, how can you protect your memory? First, avoid anything with diphenhydramine, especially products labeled PM, nighttime, or allergy relief. These are often just Benadryl in disguise. If you are taking diphenhydramine for allergies, consider newer non-sedating options such as loratadine, commonly sold as Claritin. These do not cross the blood-brain barrier and are much safer for long-term use in seniors. Remember, never stop a medication suddenly, but never assume that over-the-counter means safe. Number 8. Proton pump inhibitors, PEPIDs. Drugs like Prilosec or Nexium are PPIs designed to reduce stomach acid and commonly prescribed for heartburn, GERD, and acid reflux. Many seniors stay on them for years, sometimes decades, because symptoms return quickly when the medication is stopped. What is rarely discussed is how PPIs interfere with the absorption of vitamin B12, a vital nutrient that protects the brain while supporting memory, focus, and mood. A 2016 study, published in JAMA Neurology, examined more than 73,000 people aged 75 and older. Researchers found that regular PPI users had a 44% greater risk of developing dementia compared to non-users. By suppressing stomach acid too aggressively, PPIs reduce the body's ability to absorb not only vitamin B12, but also magnesium and calcium, minerals essential for neural transmission and brain cell signaling. Without them, neurons struggle to fire properly, leading to misfiring, confusion, and memory lapses that can mimic the early stages of Alzheimer's disease. But the issue goes even deeper. Proton pump inhibitors have also been linked to higher levels of amyloid beta plaques in the brain. These are toxic proteins that interfere with brain function and are considered a major driver of Alzheimer's disease. The good news is that safer alternatives exist. If you are taking a PPI daily, ask your doctor whether you can slowly taper off with the help of H2 blockers, such as famotidine, sold under the brand name PECID, while not perfect. H2 blockers are less likely to affect cognition. Another option is chewing a bit of deglycyrrhizonated licorice, a natural compound that coats and soothes the stomach lining. This can relieve symptoms without harming the brain. Next is a medication often prescribed for bladder control, but it may be damaging both short-term memory and emotional balance. Number 7. Bladder control medications. Oxybutynin, sold under the brand name Ditropan, is commonly prescribed to seniors dealing with urinary incontinence or an overactive bladder. On the surface, it seems like a practical solution. After all, no one wants the embarrassment or inconvenience of frequent bathroom trips. But here is the problem. This medication works by blocking acetylcholine, the very same brain chemical disrupted by Benadryl. Unlike some milder anticholinergics, oxybutynin crosses the blood-brain barrier easily and directly affects memory centers in the hippocampus. That makes it especially dangerous for older adults, particularly with long-term use. A study published in the BMJ in 2019 found that people over 65 who took strong medications like oxybutynin for more than 1 year had a 49% higher risk of developing dementia. That is nearly 1 in 2 people. What makes this more concerning is that many seniors are never warned about the cognitive risks. Doctors may say it helps with bladder control, but rarely explain it could accelerate memory decline. Often, the damage is mistaken for normal aging. Patients describe feeling foggy, forgetting appointments, misplacing items, or suddenly struggling to follow conversations. Few realize it may be tied to their medication until it is too late. If you are taking oxybutynin and notice mental changes, it is not just in your head, and you do not have to stay on the drug to stay in control. Thankfully, newer medications like mirabegron, sold as Myrbetriq, work through a different mechanism and have shown far less impact on memory. Unlike oxybutynin, these drugs do not block acetylcholine and are generally safer for seniors. Number 6. Statins. Statins are among the most widely prescribed drugs worldwide, especially for people over 60. They are designed to lower cholesterol and reduce the risk of heart attacks and strokes. Simvastatin and atorvastatin, sold under the brand names Zocor and Lipitor, are 2 of the most common. But here is where problems begin. Cholesterol is not just a heart concern, it is vital for the brain. The brain is made up of nearly 60% fat, and cholesterol plays a critical role in creating and maintaining the myelin sheath, the protective coating that allows nerve signals to travel smoothly. When cholesterol is lowered too aggressively, the brain may be starved of what it needs to function properly. In a study published in Frontiers in Aging Neuroscience in 2023, seniors over 70 who had taken statins for more than 3 years had a 26% greater risk of mild cognitive impairment. Those on high doses experienced even more noticeable declines. Even more troubling, some patients reported sudden memory loss, describing moments when they could not recall names, recent conversations, or even familiar driving routes. It is important to note, however, that not all statins affect the brain equally. Some, such as pravastatin and rosuvastatin, do not cross the blood-brain barrier as easily and are considered less risky when it comes to cognitive side effects. If you have been on a statin for years and are noticing fog, forgetfulness, or confusion, it may be time to talk with your doctor about lowering the dose or exploring alternative strategies. Do not wait until the damage becomes irreversible. The earlier you act, the better your chances of protecting your mind for the years ahead. Number 5. Benzodiazepines. This class of medications includes lorazepam, sold as Ativan, diazepam, sold as Valium, and alprazolam, sold as Xanax. They are among the most commonly prescribed drugs for anxiety and sleep problems. These medications work by enhancing GABA, the brain's calming chemical that reduces overstimulation. At first, they can feel like lifesavers. They quiet racing thoughts, ease panic, and improve sleep. But over time, they can turn into a trap. A study published in the BMJ in 2022 followed more than 8,000 seniors over a 6-year period. It found that those who used benzodiazepines for longer than 3 months had a 51% higher risk of developing Alzheimer's disease. The risk was even greater for long-acting drugs like diazepam, which stay in the body longer and build up in fatty tissues, including the brain. What happens is a kind of chemical sedation that slows down neural activity. The brain becomes less flexible, less efficient, and more prone to confusion, memory gaps, and emotional dullness. Seniors on benzodiazepines often describe feeling like they are in a fog, disconnected, or just not themselves. The worst part is trying to stop. Withdrawal symptoms, such as anxiety, agitation, and insomnia, can be severe, making the drug feel essential even though it is the source of the problem. So what can you do? If you have been on a benzodiazepine for more than a few weeks, do not stop suddenly, as this can be dangerous. Instead, work with your doctor to taper the dose gradually. Alternatives such as buspirone, a non-sedating anti-anxiety medication, or cognitive behavioral therapy for insomnia and anxiety, can restore calm without harming memory. Number 4. Amitriptyline. Sold under the brand name Elavil. Amitriptyline is an older antidepressant that is still widely prescribed today for pain, insomnia, and sometimes migraines. At first glance, it may appear to be a versatile medication, but beneath the surface it is one of the most potent anticholinergic drugs still in use. That means it blocks acetylcholine, the chemical that allows neurons to communicate, form memories, and stay sharp. It blocks this chemical so strongly that long-term cognitive effects are not just possible, they are expected. A large study published in JAMA Internal Medicine in 2015 examined more than 3,400 adults aged 65 and older. It found that those who took high cumulative doses of anticholinergic medications like amitriptyline over a 10-year period had a 54% greater chance of developing dementia. That is not a slight increase. It is more than half again the normal risk. What makes this worse is that most patients were never told the drug could harm their memory. Many were prescribed amitriptyline for sleep issues or nerve pain, and only later began noticing problems such as short-term memory loss, difficulty finding words, and foggy concentration. And it does not take a high dose to cause trouble. Even low doses of amitriptyline taken nightly over several years can cause a slow, invisible erosion of brain power. The damage develops silently. No early warning signs, just a gradual decline that looks like normal aging but is in fact drug-induced cognitive impairment. If you or a loved one is taking amitriptyline, speak with a physician about safer alternatives. For nerve pain, medications like duloxetine or gabapentin may provide relief without the same heavy anticholinergic burden. For sleep, melatonin, or a low dose of doxepin, which has a much milder anticholinergic profile, can be used instead. For mood support, there are newer antidepressants such as sertraline or escitalopram that are generally considered safer for the brain. Number 3. Paroxetine. Sold under the brand name Paxil. Paroxetine is one of the most commonly prescribed selective serotonin reuptake inhibitors, or SSRIs, for depression and anxiety. At first glance, it looks like a modern antidepressant, supposedly gentler than older drugs. But here is the part that is rarely mentioned. Paroxetine is the only SSRI with significant anticholinergic properties, meaning it interferes with acetylcholine in the brain. That single detail makes it drastically different from its SSRI counterparts, such as sertraline or escitalopram. In a large 2021 review published in Frontiers in Psychiatry, researchers examined the cognitive outcomes of elderly patients on different SSRIs. They found that paroxetine users showed measurable declines in short-term memory, verbal recall, and attention span within the first 12 months. Seniors taking paroxetine were also 30% more likely to show early signs of cognitive impairment compared to those on other antidepressants. The irony is striking. Paroxetine is prescribed to stabilize mood. Yet over time, it undermines mental clarity and emotional balance. The solution here is straightforward but critical: avoid paroxetine in seniors altogether. The American Geriatric Society has placed it on the Beers criteria, which lists medications considered potentially inappropriate for older adults. If you are on paroxetine, ask your doctor about switching to safer options such as sertraline or escitalopram, which are better tolerated and carry fewer cognitive risks. In addition, Supplementing with B vitamins, especially B12 and B6, can help support mood naturally. Number 2. Antipsychotics. This category is especially alarming because many seniors do not even realize they are taking one. Drugs such as quetiapine, sold as Seroquel, risperidone, sold as Risperdal, and olanzapine, sold as Zyprexa, were originally developed for schizophrenia and bipolar disorder. Today, however, they are often prescribed off-label to elderly patients for sleep problems, agitation, or behavioral changes associated with dementia. That is right. These powerful psychiatric drugs are being used in nursing homes and hospitals for seniors who are simply restless, confused, or difficult to manage. The consequences are devastating. In 2022, a large study in the Lancet Healthy Longevity followed more than 25,000 older adults. It found that seniors prescribed antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within 12 months, even if they had no previous history of dementia. The dangers do not stop there. These drugs also increase the risk of stroke, sudden death, and extreme sedation, which in turn raises the chances of falls, hospitalization, or permanent placement in care facilities. The mechanism is harsh. Antipsychotics suppress dopamine, a chemical linked not only to mood and motivation, but also to executive function and memory processing. When dopamine levels drop, the brain becomes sluggish and unresponsive. Seniors on these drugs often appear dull, emotionally flat, or zombified. Their personalities fade, leaving families grieving someone who is still physically alive. Correcting this begins with asking tough questions. If you or a loved one is on one of these medications, ask the doctor why it was prescribed and whether it is truly necessary. In many cases, behavioral symptoms can be managed without drugs, through structured routines, reduced noise and overstimulation, addressing underlying pain or discomfort, and improving lighting or sleep hygiene. When medications are absolutely necessary, using lower doses for shorter durations can reduce the risk, but far too often, these drugs are prescribed out of convenience, not genuine medical need. The tragedy is that many families are never told what these drugs actually do. They simply watch their loved one decline without realizing the cause is chemical, not natural aging. Number 1. Anticholinergic polypharmacy. This is the hidden danger that almost no one talks about, and it is one of the biggest contributors to drug-induced dementia in seniors. You might expect a single drug to top this list, but the most dangerous medication for rapid dementia is not just one pill. It is the silent, creeping effect of taking multiple medications with anticholinergic properties at the same time, a situation known as anticholinergic polypharmacy. Imagine this: a senior takes diphenhydramine for sleep, oxybutynin for bladder issues, and amitriptyline for pain. Each one on its own may cause only mild memory problems, but together they add up. The cumulative anticholinergic burden skyrockets. This is not just a theory. In a 2022 analysis published in Age and Aging, researchers tracked more than 280,000 older adults. They found that those with the highest anticholinergic burden had a 120% greater risk of developing dementia within 10 years. That is more than double the risk. The most alarming part is that many seniors have no idea they are even taking anticholinergic medications. When acetylcholine is blocked from multiple angles at once, the brain does not just slow down, it begins to deteriorate. Neurons wither from lack of use, synapses shrink, and the brain enters a hypoactive state that mimics Alzheimer's disease. Correcting this does not require a miracle. It requires a thorough medication review. Ask your doctor or pharmacist to go through your complete list of prescriptions, over-the-counter drugs, and even supplements to evaluate their anticholinergic load. There are professional tools and online resources that calculate the total burden. Once identified, you can begin the process of deprescribing, slowly tapering off unnecessary medications, switching to safer alternatives, and rebalancing brain chemistry. This is perhaps the most empowering part of this entire video. Drug-induced dementia is often reversible. When the burden is lifted, many seniors regain clarity, energy, and memory within weeks or months. The brain is resilient, but only if you give it the chance. Anticholinergic polypharmacy is not only dangerous, it is preventable. And that makes it the #1 hidden medical threat to the minds of our aging population. Now we want to hear from you. Which of these medications are you currently taking? Have you noticed brain fog, forgetfulness, or personality changes since starting a new prescription? And most importantly, are you willing to talk with your doctor this week about reviewing your medications? Share your experiences and thoughts with us in the comments below. We would love to hear from you. Thank you for watching.